Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of what I call the Common Sense MD. Today I have a really special guest that I couldn't wait to talk to. His name is Dr. Ben Edwards. If you've been following the news about measles in Texas, well, he's kind of the expert on this. He's been in the news, and fortunately, through Jamie and Donna Winship, who are dear friends of ours here in Kingsport, Tennessee, they contacted me with Dr. Ben Edwards, and he's been very gracious to appear on this podcast. And so we're going to talk about measles, but Ben, tell me a little bit about your practice, about integrative medicine and your journey towards, because we're both family doctors and we both got into integrative medicine through A4M, and your story is very similar to mine. I love your story. I know we're doing the right thing in the way we practice medicine. So tell me a little bit about yourself first. You're in Lubbock, Texas.
Yes, sir. Thank you, Tom, for having me on the show. I love to talk about good medicine like what you practice. So basically my story started in Central Texas, where I grew up in a small town, and both my granddads were the GPs in town. And they were those old school doctors that did everything. Could do a little surgery, deliver babies, do house calls, had a little hospital in town that they made. I mean, they built this thing themselves and just took care of the whole town. So I grew up watching these guys obviously be just pillars in the community, not only the health community, but across the board, deacons at church and the school board members and just leaders. But seeing how they helped so many people was obviously very impactful. So actually, one of my kids today was just asking me what I wanted to be when I was a little kid. What was I dreaming to be? And it was actually, I want to be a Dallas Cowboy wide receiver, when I was 7, 8 years old. But then I thought, man, I want to be a coach or a teacher, a preacher. But the doctrine thing, it was always there. I thought I wasn't smart enough. I thought it'd be too much schooling, take too long, too much debt. But I finally gave in to the call and went to UT Houston Medical School, the Texas Medical Center, MD Anderson, one of the best conventional cancer hospitals in the world. So it was a great place to learn conventional medicine. And then went to Waco Family Practice. I was chief resident there, and that was in 2005 when I graduated and started out in a little county clinic in West Texas. My wife and I prayed about going to a small town. We wanted to find one that needed a doctor. And of course, they all needed a doctor, but the ones we looked at all had at least one doctor. But Garza County didn't have one doctor in the whole county. And the Lord said, go there, and we did. And that was in 2005, spent 7 years there. And not to talk arrogantly, but Waco trained me of how to do procedures and how to do volume, 7-minute visits to keep a county clinic open that's Medicaid, Medicare as your primary payer. You got to do volume, you got to do procedures. And anyways, that county clinic had been losing money every month for years, for 10 years. And the healthcare district board, when they hired me, said, hey, these taxpayers are tired of footing the bill. We got to get this thing in the black. Can you do that? So heck yeah, I can. I know how to do that. And so we did. And we turned that thing around, and it was making money finally. So much so that the tax money was sitting in the tax account because they were still collecting taxes, but not spending it. So that thing grew and grew and grew. They built a brand new $1 million clinic. In 1 year had the $1 million banknote paid off. 1 year after that had $1 million back up in that savings account because the clinic was self-sufficient. So then we got kind of some notoriety because we were so successful. I'm putting that in quotes because I'm talking only financially right now. We were financially successful. We were in the top 95th percentile of all clinics in America for number of visits, number of collections, overhead, all the financials. So everybody's happy. The taxpayers are happy. The board members are happy. I'm happy, getting a good bonus check. Everything's cruising along. Texas Monthly, which is a magazine here in Texas, did an article. And then the Washington Post picked up that, came and followed me around for a week and put us on the front page of the Washington Post. So I'm just painting this picture of I'm living my dream, small town country doctor, covering the Friday night football game team doctor, the nursing home, the county jail, the juvenile detention center, making the house calls, doing that for 7 years, raising the kids in a small town. I didn't know anything about holistic, integrative, functional, anything alternative. Zero. Both my granddads are MDs, two uncles are MDs, great granddad's an MD. So I'm just doing my thing, cruising right along. And then a divine appointment after 7 years of working like this. Now, I will say, I was getting a little frustrated. Just, that system of just cranking through them, these 7-minute visits, all the paperwork, everything was transitioned to electronic medical records. That was frustrating. All the coding, all the billing, all the denials from insurance and doing the prior author, all that. I mean, that was frustrating for sure. But also, these patients are just sick. I mean, I was diagnosing kids with type 2 diabetes. And I was tracking these kids every year doing the athletic physicals for the football team, the high school, junior high football team, and watching these kids year by year. They're getting heavier. They're getting on meds. I mean, reflux meds, blood pressure meds in high school kids, asthmatics who used to be controlled on a little bit. Now they're on 2 or 3 agents, just sicker. But, what do you do about it? I was doing what I was trained to do, give them medication to treat those symptoms or diseases. Anyways, after 7 years of that, my nurse practitioner who was working with me in that county clinic took his wife for a getaway weekend to a bed and breakfast in another town north of Lubbock called Amarillo. And my nurse practitioner had celiac disease. So we told the lady at the bed and breakfast, I need a gluten-free pancake because I have celiac. And she said, well, I can cook you that, but there's a doctor here that could cure you of that. Which my nurse prac, of course, blew that off, said there's no way, that's not curable, and you're crazy. But the lady kept pestering him all weekend long, and the doctor's office was in the bed and breakfast. So he was right there. So to get the lady to leave him alone, basically, and shut her up, he said, let me just meet with this guy. And anyways, that doctor, who was an MD, PhD, he was the first exchange student with a university in China, in Texas Tech, where he had gone. Brilliant guy, ex-Marine. And so he was holistic, and he told my nurse prac some things to consider doing. And my nurse prac got convinced, and it was a 4-hour conversation. And he walked out of that conversation thinking, man, that guy just made a lot of sense. I'm going to implement some of these things. And the nurse prac never told me what he was doing until 3 or 4 months down the road. And I'd noticed that nurse practitioner was just seemed healthier. His complexion was better. He kind of had a glow about him. He trimmed up, was getting more fit, was happier, more energetic. You can tell when someone just kind of, the life's back in them. And then he came and told me after 3 or 4 months, hey, doc, I think my gut's healed from celiac. And I said, what are you talking about? Get back to work, you crazy. I totally blew him off, kind of offended him. So he went to the break room in the clinic, and he brought a breakfast burrito out that a drug rep had brought that morning. And he starts chowing down on that thing. Obviously a tortilla, wheat, gluten, where normally he wouldn't even scrape the eggs off the tortilla and just eat the eggs because of cross-contamination. He wouldn't even sniff gluten, used to. Now he's eating it. And then he goes at lunchtime and gets a hamburger at the local hamburger joint, eats it right in front of me at the nurse's station. And then a drug rep brought cookies that afternoon, and he ate one. So 3 glutens back to back to back in one day. And I'm thinking, you're nuts. You're going to call in sick tomorrow. You're going to be sick for days. And he was fine. So then I start rationalizing, whoa, what in the world? He came to work. He's not sick. I question him. And then I thought it's just going to be a delayed reaction. Give it a day or two and he's going to crash. And he didn't. And he's telling me, of course, I'm healed. And I'm thinking, there's no way. I'm just wait for it. And then I started thinking of, well, maybe God just miraculously touched him and healed him for some reason. Or maybe this is just I don't know. You just start trying to figure out, how could this be? And the whole time he's telling me what he was doing, and that this could be, other patients could do this. And sorry about that. Anyways, that was a big moment because I felt a moral, ethical obligation, because I knew I was going to have another celiac patient come in those doors someday. And was I going to hide this testimony? Because that's just a one story. Doctors are trained. You don't go by anecdotal. That's a one thing anecdotal, That's not even barely evidence. That's the lowest form of evidence that there is. Basically, don't even listen to it. But in my heart, I knew I can't hide that. I mean, I've got to not say, hey, we got a cure to celiac here, but say, hey, here's what I learned in med school: eat gluten-free the rest of your life. That's my official standard of care answer. But hey, here's a testimony over here. It could be a one-off thing. I have no idea what he even did. And if you want to talk to him, I mean, that's your free choice. I'll give you, these both options basically. And so that's what I did. I decided, yeah, if another celiac patient comes, Shane, my nurse prac, is going to get to see him, and he can share with them what he did, and then we'll see. Maybe it'll work for the next one. I mean, so I was just open-minded like that. But of course, he's my nurse prac under my medical license, under my authority. I got to know what he's doing and saying and behind those closed doors because he's representing me. So I thought, man, I'm going to have to call that doctor up. So I did. And the doctor in Amarillo. And I just start grilling him. Like, who are you? What are you talking about? What are you doing? What kind of quackery, hocus pocus, crystals? And this doctor just came at me with the truth. I mean, he was just coming hard, like saying, Ben, there's no such thing as diseases. They're all consequences. If you weren't born with it, you probably don't need to keep it. And I'm like, no diseases. What are you even talking about? And I grabbed my schedule from the day. My nurse prints that schedule off, put it on the top of the nurse's station so I could just mark off every time I saw a patient. And I had 40 patients, 40 different diseases. Most of them had more than one disease. So I just went down the list. No diseases. What about diabetes and asthma and fibromyalgia and lupus and ulcerative colitis and cancer and heart disease? I mean, all of them. And he said, take that list home tonight, young man, and Google every one of those quote unquote diseases that are all consequences. Google the word inflammation plus that disease, all of them. Depression, inflammation, heart attacks, inflammation, cancer and inflammation, lupus and inflammation, asthma and inflammation. And he said, you'll see a connection. And so I did. I went home and did that. And there was this amazing connection, this thing about inflammation. So then I'm calling him back. Okay. I did my homework, and yeah, I see what you're saying. There's this connection. I didn't know that. No one taught me that. And he said, well, why don't you be a good doctor? And why don't you be a good detective and dig a little bit? Where's inflammation coming from? So I had to go dig through that. And you get down to this oxidative stress free radical thing. And then you get down to the mitochondria. That's your energy factory in the cell. And if it's not making enough energy, it's making too much exhaust. That's the free radicals. Those free radicals go damage the cell, damage the cell membrane where the hormone receptors sit, damage the mitochondria, turn on the bad genes. They damage the DNA. It started to all kind of come together. So it was kind of making sense. That part of us, the truth that hits our spirit man that says, that's a truth, that's a truth. That thing was dinging on me. But then my intellectual man kicks in and says, there is no way, this can't be, there's no way. And then when he told me, this is what really got me. He said, Ben, type 2 diabetes, totally reversible. And this was back in 2011-ish. And I said, you're lying. There is no way type 2 diabetes is totally reversible. If that were true, MD Anderson, endocrinologist, would have taught me that. Waco Family Practice, who's full of good Christian doctors, good Christian men. They train doctors to go to the Christian mission field, Doctors Without Borders and all that. Those guys would have taught me that. The local endocrinologist here at Texas Tech would be doing it if that were true. So there's no way. And he said, just go Google on YouTube, watch this guy tonight when you get home. And it was some engineer, just a layperson, not a doctor. And he showed how on YouTube he was reversing his diabetes. His A1C went from this to normal, off his meds. And I was watching these YouTubes all night long, woke my wife up in the middle of the night at 3 a.m. I'm waking her up going, babe, look, this guy's reversing diabetes. I cannot believe this. How could this be? Because in Garza County, probably like most counties in America, half the county was type 2 diabetic, and the other half were going to be if you gave them enough time. And when you're diabetic, as you well know, you increase your risk of cancer, heart attack, stroke, Alzheimer's, just about everything. So I'm like, if this is true and we can reverse diabetes, we just cut this patient's risk significantly for all these killer diseases that Americans die from. This is amazing. But then that intellectual part kicks in. There's no way. And I just went back and forth like this cognitive dissonance in my head. And on the phone, always talking to him, and he would send me stuff. Watch this, go to this conference, A4M, read this book, watch this thing, read this article. And I mean, I'm busy. I'm seeing 40 plus patients a day. I've got 4 kids at this time. They're tiny. We're raising kids. We're busy. So one day I call him and say, hey, I appreciate all this you're sending me, but I'm busy. Can't you just send me one book that summarizes all this alternative medicine? And he yelled at me through the phone, said, alternative? What do you mean alternative? And I said, well, just all this hocusy pocusy quackery stuff. And he said, okay, big shot, Mr. Front Page of the Washington Post, you're so busy and famous. I'm sure you're busting at the seams in that new clinic they built you. What if you have to build an addition to your clinic? Who are you going to call to design that? The engineer or the alternative engineer? Next time your car's making a weird noise, you're going to take it to the mechanic or the alternative mechanic. Next time you get on an airplane to fly to a medical conference, you're going to go with the aviation guys or the alternative aviation guys. And he told me, he said, Ben, God created all this and he put laws into the earth. All mechanics have to follow the same law of internal combustion. All airline pilots follow the same laws of aerodynamics. And every doctor, if they're a good doctor, would dig a little and learn to follow the laws that he put in to govern the physical cells, the DNA, the mitochondria, and just this physical flesh. Now there's spiritual laws too, and that's a beautiful interplay, the spirit and the soul and the body all coming together. But that really got me. And the final straw, and then I'll be done with this story. I'm sorry it's long-winded, but is when he said, I'm tired of arguing with you. Send me your 10 sickest patients and I'll just show you. And he clarified that. He said, I'm talking your sickest patients that you've referred them everywhere you know to refer them to, all the specialists. They've been to Southwestern in Dallas. They've been everywhere. And they're back in your office because it ain't working. And when you see that person walking through that front door and checking in at your front desk, you cringe on the inside. I mean, you're polite and you're going to be nice to them, but on the inside, you're like, oh man, Miss Smith is back because I ain't got nothing for her lupus or fibromyalgia or whatever. He said, those are the ones I'm talking about. Send them to me. I mean, the sickest of the sick. I'm like, oh, I got plenty of those. So I did. I sent him some really sick patients. And one in particular that really got me was a 74-year-old gentleman. He's 320, 330 pounds on 9 medications. I'd taken care of him since I've moved to Garza County. So that was 7 years of me seeing this guy and writing these medications. And he was a former coach. And he was on triple therapy, oral therapy for diabetes, plus hypertension and cholesterol and arthritis and reflux and 9 medications. But these 3 meds for diabetes, they just weren't working anymore. His sugars were still climbing. And I said, Coach, you need insulin. That's the next step. I'm sorry. And he said, no, I'm not going to give myself shots. I'll die before I do that. I'm pretty much dead anyways. I can barely get out of my recliner. I'm just tired. I'm fatigued. Life ain't worth living. And I'm not doing shots. And I'm like, Coach, this ain't going to be good. This high sugar, you get a stroke. You're going to get a foot ulcer and amputate your toe, your kidneys. You're going to shut your eyes and you're going to go blind. I mean, I just laid it all out, which is true. That's what uncontrolled diabetes can get you. But he said, no, I ain't doing it. And I said, well, there's one other option. There's this crazy doctor up in Amarillo. He doesn't believe in diabetes. He doesn't think that's even a disease. And that coach said, sign me up. I'll be there tomorrow. And he did. And that coach, he lost 40 pounds. His blood sugar normalized. His blood pressure normalized over 3 to 4 months. He comes back to see me. He's off all those meds except for half of one blood pressure pill. His blood sugar's normal, A1C normal, off his meds, not on insulin, not on pills. And that was it for me. I said, I'm all in. And there were 9 other patients, similar, really bad diseases that they'd been to all the specialists, and they all got better. And so at that point, I said, I'm in. I mean, I went to med school to help people. I've never seen patients get better like this. So I don't care that part of my brain that says, what in the world? And there's no way. I saw it with my own eyes. There's another anecdotal, 10 anecdotals. That's it. I'm in. So that was it. I decided to really dive in deeper and start learning more. Went to the hospital board and told them, hey, here's what I'm learning. And people get well, they get off meds. but it takes time. I need an hour to do these visits. Really, it'd be better hour and a half or 2 hours sometimes in the real complicated ones. So if enough people ask me to help them reverse disease, resolve disease, get to the root cause, if they're asking me, I'm not going to say no. I'm going to tell them to make a follow-up appointment for 1 hour. So I'll warn the hospital board that if enough people are doing this, you can do the math on that. I'm only going to see 8 or 9 a day instead of 40, and the money's going back in the red, and we need to come up with a plan. So I started scheming, planning. I will get another doctor in here. He can run them through like cattle. I can do my nutritional thing 2 or 3 days a week. We'll kind of tag team. And I had this plan hatched, and the Lord brought a doctor, and that guy was like, "Oh man, Ben, this sounds great. I don't know any idea what you're talking about with nutrition and stuff, but fine, do your thing. I'll crank through the clinic like you do, the nursing home, the county jail, juvie, and the house calls and your nutrition stuff, and then I'll just do clinic. We'll tag team. Yeah, we're good." Well, the management company out of Lubbock, who the county clinic had contracted with, they thought 2 doctor salaries on this it ain't going to work, and you're out, Edwards. So they fired me on a Friday afternoon, told me to be out by Monday, and there we go. We started Veritas Medical. Veritas is Latin for truth, and I bought a used office desk and 2 used office chairs and a laptop. I'm all in for about $500. Bought one of those little square stripe thing, or swipe your credit card for your phone. Bought one of those, and I rented a little room from the Farm Bureau insurance agent downtown Post, Texas, in Garza County, and for $100 a month, I could rent that little room. And I just started seeing people, and they just started coming, and word of mouth, and it grew and grew and grew. And at our peak, we were at 4 different locations with 9 nurse practitioners over the past 13 years. That's what we've been doing. About 2 years ago, the Lord really told me, listen, for 10 years, Veritas Medical has been reactionary, last resort. Mostly the people that were coming, last ditch effort, Hail Mary, let's go see the holistic guy. They're so sick, suffering so much. And God said, you need to get upstream and get proactive instead of reactive. You need to get first option instead of last option. And of course, my intellectual brain said, "There's no way that ain't going to happen. People aren't going to pay cash money up, early on when they're not that sick. They're going to wait for till the bomb's gone off." But he said, "Yeah, but their boss will." So corporate wellness. So we opened a wellness education company about 2 years ago. And we teach what we call the 4 pillars: nutrition, hydration, movement, and peace. And companies pay us to try to teach their people the truth so they get well, reverse their disease, get off their meds. It saves the company money, better productivity, happier employees, and we don't have to clean up a big mess 10, 20 years down the road when we can snip that lit fuse early on.
That's an incredible story. Honestly, you are the kind of doctor that is just, kind of my hero type doctor. I have a very similar practice. I look for root causes. I shy away from medications like I used to. Really, I think medicine has been bought out. Mm-hmm. I'm similar to you. 18 years ago, a light bulb went off in my head after I went to an A4M conference. And I realized that, as a doctor of many years, I've been practicing 38, almost 39 years now. A light bulb went off that I was practicing the entirely wrong way. In the meantime, 2 of my kids had come down with type 1 diabetes. I realized very quickly that I knew nothing about nutrition. So I really wanted to dive into nutrition. What I found out was that everything they told me was completely wrong. Mm-hmm. So I really started looking at it in a different way. I was seeing 40 to 50 a day. Now I see at the most 10 to 12 maybe a day. And when I got rid of the 3 things that I didn't like about medicine, I love being a doctor because we help people. It's almost, if you're a family doctor, you're not doing it for the money. You're doing it to really help people. Yeah. And I'm like you. I come from a long line of doctors in my family: my father, my brother, my great grandfather, all my cousins. So I've been around it my whole life. And when you just see the progression of what's happening in medicine, it's almost like it's bought out. It's all about the money. So I got rid of the 3 things I didn't like. Number 1, insurance companies. I've been a cash-based practice for 18 years. All my podcast people know that. I got rid of the EMR, and I got rid of non-medical managers that are telling me what to do, how many tests I need to order, etc. So what's happening is that, because everybody told me, you're nuts, you have a huge practice, why are you doing this? I go, because I just can't stand it anymore. I'm burned out on seeing a patient every 7 minutes, and everybody's still fat. Nobody's getting better. All I'm doing is pouring more medicines on them. Their numbers may look a little better, but they're no happier. They're no healthier. And I'm just doing it completely the wrong way. So what happened to me was, number one, I became a much better doctor. I was happier. I mean, here I'm 70 years old. I'll never retire. I love what I do.
Yeah.
And three, economically, I'm just as well off as I was before.
Yeah.
I'm helping the patients better. There's no way you can help a patient in 7 minutes, but like you say, we're trained to put a label on that patient. You're a bipolar. You're a reflux patient. You're a diabetic. You're hypertensive. You have metabolic syndrome. And then they come down with cancer. So we're labeling these people. They're really just human beings with symptoms. And if we get to the root cause of the problem, like you said, you start with the gut. You have to heal these people's gut first.
Yep.
And, if you follow like Dr. Makery out of Hopkins, who's going to be on this new administration, and read his book about cognitive dissonance, it's exactly what you described.
Yep.
I mean, it's very hard for a doctor like you and me to turn the page and be completely different. But occasionally you see one like yourself or me, but it's rare.
Yeah.
It's very rare, and it's almost like, I won't say you get shunned, but you get thought of in a little different way. Fortunately, in this town, everybody knows me. I grew up here. My family, my dad, my brother, great reputations. So eventually, I started out seeing 2 patients a day from going from 40 to 50 when I went on my own. And, at the time I was able to do it because I'd made enough money to kind of raise my kids and all that. So it's just turned into something marvelous. It was a God thing, really. And if you practice medicine, if you don't bring some of that into it, then you're really doing your patients an injustice, because the psychosocial model of medicine is very important. And sometimes what I find is, when I see a patient that has 5 autoimmune diseases and they're miserable, the fibro patients, the lupus patients, the Sjogren's, all this stuff. And if you get to the root cause of the problem, what I find, Ben, is it's something kicks it off. I mean, we're all like a loaded gun. Something pulls the trigger. And a lot of times with these, especially in women, I find that it's childhood trauma that brings it on. And if you don't get to the bottom of that, but that takes time. It takes, it takes a long time for you to get into that, and maybe some more expertise. But anyway, so I've got a great idea about your practice. You're very similar to me. Kudos for what you've done. I mean, you are doing the right thing. And a lot of other physicians and might think we're kooky, but I see a lot of physicians in my practice. They come to me, and they really know this is the right way to do it. But in any event, I had heard about you through following the Children's Health Defense. I probably, myself and one other doctor in this whole area, were the only ones treating COVID. I know I treated 10,000 people with COVID. I was definitely an outlier with that. I'm convinced we saved a lot of lives through using medicines like ivermectin and hydroxychloroquine, budesonide, high doses of vitamin C intravenously, high doses of prednisone. So with that said, the practice boomed. Of course, we got censored because we were forthright with telling what we thought about COVID. And at this whole point of this thing here is to talk a little bit about measles, because that's how I heard about this measles outbreak in Texas. And I'd actually seen some of your interviews and read about you. And I was in church one day, and Donna and Jamie Winship were there. Jamie just married my son, Ben, who you just met a month ago. And they said, Tom, come here. We went down to Lubbock and met this Dr. Ben Edwards, who is like you. And I said, Ben Edwards, the guy that's treating the measles? I said, I can't believe this. I've been reading all about him, and this guy is just incredible. I love what he's doing. So tell me about this measles thing, how you got involved in that, and the girl that had passed away, the young girl from measles, and then you got involved with the family. I read the whole thing. So tell me a little bit about what came about that you were in this fortunate situation to help people with this measles outbreak.
Yeah. Well, just like you, Tom, we treated COVID. We never closed. We treated a lot of other doctors' patients who weren't treating. And of course, I mean, our clinic's been here in Lubbock for 12, 13 years. So people know about us, and we have some Mennonites. So Gaines County, where the measles outbreak kind of ground zero, that's about an hour south of Lubbock. But some of those Mennonites are my patients, probably 20 or 30, are just routine part of our membership here. And one of those called me. It was on the weekend, on a Saturday afternoon, reached out to me to ask if I could come down and see the siblings of the little girl who had just passed away in the hospital, because they were sick with measles, and the mom was, and the dad, but really mama was super scared. They weren't real happy with how things went in the hospital as far as treatment or lack thereof. And so they were scared to go back to the hospital, and they were just scared that maybe the other kids might die. Anyways, so that's how I got involved, is because my patient who knew the family, and the family had reached out to my patient. So I went down there. Actually, had a couple kids with me because we were out the horse barn where my daughter takes horseback riding lessons, and it was south of Lubbock. Anyways, it was just easier just to zip down there, and thought I'd just run in there, see these kids, and come home. And it was actually at the church. They were doing the viewing of the little girl that passed away, and it was an open viewing. So they asked me to come in. The family was in the room where the body was, and the siblings were there, and a lot of that community, Mennonite community, was coming in to pay their respects. And there I saw a lot of families walking in and out that door with a lot of kids, all with rashes. I mean, it was a lot of measles. Anyways, I saw the siblings, recommended a couple of things. I knew vitamin A. I mean, I hadn't seen measles before. Most doctors haven't. But I'd read about it. I'd heard about it, of course, from my parents and a lot of my older patients. They all had measles, and that's kind of a normal childhood routine thing. So I knew some about it. And I knew vitamin A was super important in measles. Anyways, cod liver oil is what I prefer to give for vitamin A because it's a food-based form. It has D with it naturally in a 10-to-1 ratio that's found in nature, and A and D work together in the body like a hand and glove. I mean, they kind of work real. And then you got these, food always has multiple components to it. You have all these other phytonutrients with the food, these cofactors that help those vitamins work better. Anyways, and it's almost next to impossible to overdose on a food-based form of vitamin A. So that's what I recommended to the family, and some vitamin C. I'd actually ran by my clinic and grabbed a bunch before I headed down there. So that's how I got involved. And I was leaving the church, leaving the viewing to come home, and the dad of the little girl that passed away came and pulled me aside and said, "Hey, my wife's brother's got 8 kids, and the youngest 2 twin baby boys. They're 4 months old. They have the measles. There's one of them in particular super sick. They've been at the ER, but the ER asked them to just wait outside in the parking lot. It's been 45 minutes of waiting, and no telling when they're going to be able to be seen. Could you see them?" And I said, "I'm happy to see anybody." And so I went and saw that they met me at their house. And those little boys, the one little boy, 4-month-old, was lethargic, super hot, high fever, rapid breathing, and just glassy eyed, kind of almost floppy. But I mean, when you see a sick baby, that's not good. And the lungs sounded pretty rough. I mean, it kind of reminded me of COVID. Now, COVID never hit kids that hard, but that it was like COVID for kids is sort of the first thought. Man, this baby and these lungs, this is not what I read about in the books. But so I felt like budesonide, because budesonide works so well. That's a nebulized steroid, as you know. It knocks down inflammation in the airway, and I just thought it'd be worth a shot. So, I mean, we got the cod liver oil, and actually, what I did first, because that mama walked in, these two carriers, she's carrying these twins, and I mean, she had them quadruple bundled up for some reason. It wasn't that cold, but she had three onesies on and three blankets. So just getting all that off of them, I laid them out on the dining room table, prayed over them. I mean, examined them, prayed over them, and they started to just ease up and calm down and breathe easy. And I told the daddy, we need some budesonide. Do y'all have a nebulizer? Yep, we have a nebulizer. Okay, we're going to get some. There was no pharmacy in Gaines County on a Saturday afternoon open. And then I ran up to Lubbock and found out there used to be a 24-hour pharmacy, but not anymore. And the only pharmacy that opened till 9, there was one. So I ran there, got there about 10 till 9 in the evening, got the prescription and went back down there. And that little baby just turned around quickly, and just not only the lungs and the respiratory rate, but he just calmed down in general, and then took a bottle, because he'd only had 2 ounces all day. He was getting dehydrated. He took 6 ounces over the next 3 hours. And the next morning, Sunday morning, I went back down there, and this looked like a new kid. I mean, color was back. He was just bright-eyed looking at me, just life was back in him. And I told the dad, I said, no, this must be the other twin. You got them mixed up. And the mama looked at me and said, no, that's him. I couldn't believe it. And that's when I knew, okay, this budesonide, it's going to work for this. But they told me that night, they said, there's 8 more babies under 2 years old just in this family that have the measles, because in the extended family, the aunts, uncles, cousins, could you come see these 8 more babies? And so then I just had the thought, man, how many are there going to be in the whole community? And it was Sunday morning. So I called that patient who had connected me initially. And I said, how many Mennonite churches are there down? And she said, 12 different kind of denominations within the Mennonite, 12 different churches. And I said, well, could you get a message to all 12 pastors and announce from the pulpit, if there's any sick babies with measles that are struggling, that are under 2 years old, meet Dr. Edwards and they gave a location. It was just an empty kind of warehouse building. They made a makeshift clinic real quick. Go there. He'll just, instead of me going to everybody's house, we'll meet at a central location to be more efficient. And then after that, 10 and under we'll do. So kind of triaged them. And then I'd called a couple supplement companies that I know are good quality cod liver oil. And one of them had the quantity I felt like we needed, because I asked my patient, how many Mennonites are we talking about? And she gave me a number. So I did the math, and I said, we're going to need this much. We're going to need a lot of cod liver oil. And this company had it, but it was in Scottsdale, Arizona. And he said, I'll open up the warehouse on a Sunday if you can get an airplane in the air and get here. And I was in communication with some state and national authorities at that point. I kind of reached out to them to see if maybe they'd want to do that. And it was, you know how the government works. They want a real quick answer. Well, I had a patient from Gaines County. I knew that it was a pilot. And anyways, long story short, we had a private plane from Gaines County take off on Sunday morning to Scottsdale, loaded up vitamin C and cod liver oil. And 2:30 in the afternoon, they had landed at Gaines County Airport. And I met them in the hangar with my pickup truck. We loaded up the truck and went to that makeshift clinic at the warehouse. And the Mennonites started just pouring in there. And there were so many sick babies. Not all were as sick as that one 4-month-old. But anyways, I saw 70 that day, that afternoon and into the evening, and finished up about 11 o'clock at night, headed, or 10 o'clock maybe, and was headed back north to Lubbock, and got some calls that, hey, there's some Mennonite families between Seminole and Lubbock. Could you just stop by and make some house calls on the way home? And so I did that, and it was just these families were scared. I mean, word got out, because the mom and dad told me at the viewing, they asked for breathing treatments in the hospital, were refused, and were told those won't work. And that word got out real fast. And so these families are scared to go to the hospital. So I'm walking into these Mennonite little homes and out in the country, these farmhouses, and these just scared. Mom and dad scared, the kids scared. It's midnight, and there's 8 kids just sitting Indian style, lined up against the wall, just quiet as a mouse, but coughing, fevering, and just the saddest thing. And I
And they
thought,
had the
man,
rashes, the typical
yep,
rash of measles.
yep.
Yep.
So, I went back the next day, so that'd be Monday, um, and saw, I think in total over 100 that day, and then went back the next day, and I called my friend, Dr. Richard Bartlett, who's a West Texas physician too, and he got famous during COVID because he was praying he's an ER doctor, and he was praying one evening while he had a shift during COVID in March of 20, and asking the Lord, what do I do for if a COVID patient comes in? And he got the thought, you need to give them the budesonide to decrease inflammation, give them an aspirin to decrease clotting, and give them a clarithromycin for secondary bacterial infection. It was a triple therapy thing. He was doing that March of 20. And he saw the effects of that. He was interviewed a few times. One of those went viral. So the word got out on budesonide. And he became like the budesonide guy. He's got all the research just in his head. And I called him because there were a couple more kids in the hospital, and I'd sent those parents through my patient. Kind of this lady's, Tina Siemens is her name. She was my connector into the Mennonite community. She's Mennonite heritage. But anyways, I said, Tina, let's text these families this website, budesonideworks.com, because it has all the 50 published studies on it. And those moms and dads can show the doctor in the hospital, and maybe they'll start using it. Well, that didn't work. So I called Dr. Bartlett and I said, Dr. Bartlett, here's what I'm seeing. I just saw 70 patients today, and budesonide's working. There's kids in the hospital. Is there, any way you might could help out? And he said, I'll be there. First thing in the morning. I get off my shift in the ER at 7 a.m. in Amarillo. Amarillo's north. So he's driving south, drives through Lubbock to get down to Seminole. And he stopped in the hospital, met the family in the waiting room. He was friends of the family. And he went in and talked to the doctor, and the doctor, after some talking to and some evidence, said, okay, we'll do it. Immediately, that in the ICU, this little girl's oxygen level started to rise for the first time. One treatment of budesonide. And then the next morning, got another second treatment. That afternoon, a third treatment. So after 3 treatments, discharged home from the ICU 36 hours after starting budesonide. So that was Dr. Richard Bartlett helping to get that going in the hospital. And then he came down to Gaines County and saw patients with me that Monday. So that's kind of the short story of it. I got to visit with Bobby Kennedy and Dr. Susan Moran's head of CDC, and then the state health authorities. They've got their approach, which is prevention, and that's fine. And I mean, that's a whole nother discussion about prevention and risk and benefit of that. But the point was, we had sick kids. And so a vaccine's not for when you're sick, a vaccine's for prevention. And these are sick kids and they need treatment. Can we talk about treatment? And it was amazing, the response. And the answer was, no, we can't, from the state health authorities. I said, I really need your help. I need these hospitals and clinics in West Texas to know that budesonide's effective. It's helping. I've seen it with my own eyes. And if they would do that, then the Mennonites would hear that, and they'd go to these other clinics. They, instead of just come to this little makeshift thing that I just threw up in a second. I need help. Can you put a statement out to say that? No, we can't do that. It was unbelievable. To this day, unbelievable.
That's just hard to believe that
that
happened.
And I don't know what's wrong with our profession, that we've just been so tunnel vision down, so protocol. And if this authority, some agency puts down an edict of this is the only way to handle this situation, then we blindly just go that way, and we lose our clinical judgment. We lose the patient's wishes, and let's try something, and let's use our skill, our knowledge, our experience. Let's collaborate with other physicians. Let's do something.
I often wonder if it's because they're scared of getting sued because it's outside their protocols, if they're scared of being labeled a quack because this is a different kind of treatment, cod liver oil. You know,
Yeah.
I
Yeah.
wonder if sometimes I think finances come into play there. It just, I always wonder about that Hippocratic oath we take, do no harm. I wonder if that's a really good oath because, as my father told me when I went into medicine, when you don't know what to do something.
Yeah.
And that's the thing about COVID and now measles. They're not doing anything. There's things you can do. It's going to be outside the box, but it's a shame. I mean, it's downright shame. And I will tell you that I'm so proud of doctors like you. In my opinion, you're a saint. I mean, for what you just told me that you did, the lengths you went to save lives is just incredible. No wonder Bobby Kennedy Jr. called you. I mean, that I think he's kind of a hope for our medical profession. It's got to change,
Yeah.
Ben.
It
It
does.
has to, or our country is getting worse and worse, more
Yep.
unhealthy, and it's
Yep.
because of our system that we've set up. It's not that complex.
Yep.
There's some simple things, and it's been bought out by big pharma. Insurance companies control medicine, and you have a lot of academics that call the shots that don't even practice medicine. I mean, boots on the ground physicians like you that are actually going in and seeing these patients and not only having ways to treat them, but you're also using your faith, you're praying for them. I mean, I always tell my patients prayer works more than anything. God
Yeah.
directs me in my treatments of patients. So, I don't care what anybody
Absolutely.
says, I'm going to tell people that because I know it's true.
Yeah.
And your faith is what got you into those Mennonite communities.
Yeah.
And thank God for people like you. There's just not many people like you, much less doctors. Doctors get caught in this trap and they're
Mhm.
afraid to do anything.
Yeah. I know. And that's why I love Jamie Winship, living fearless.
That's right.
And you not letting fear influence a decision. And that's what I've been telling whoever will listen is, to me, there's one way out of this mess that our profession, the healthcare industry in general is in. It's confession. We got to start truth telling. Confess when we mess up, when we do the wrong thing. Hindsight's 2020. Okay, maybe it's some crazy worldwide pandemic nobody knew. Well, now we know, and we can say, I got it wrong and I'm sorry. That's step number one. And the arrogance and pride to not even be able to say, I'm sorry, we screwed up. We did the wrong thing. If we can't do that, then you're right. I mean, this thing's just going to keep cratering. Now, there will be, and I love how Jamie talks about kingdom versus empire. I mean, it's not hopeless at all. If you're seeking the kingdom first and your motive is love your neighbor, as opposed to in the empire, love your position, your title, your paycheck, yourself, love what other people think about you, love being right. Those are all things that are going to continue to draw you or drive you into the empire. But the kingdom's coming, has come, is coming, and will come. And that's the truth. And that's love based. And that's selflessness. And there's plenty of those people in all industries. We just have to recognize at a deeper level and trust and step out there and do the right thing. And if it means someone comes after you and your reputation, your license, well, I'm going to trust God
I
to
couldn't agree
protect
with you.
that. Or maybe he needs me out of that industry, whatever he says. I mean, let's go.
Couldn't
But
agree
we
with
got
you
to
more.
start with the confession, I think.
I agree with you 100%. And just like they got COVID wrong, they lied, and they need to come out and say
Yeah.
they got it wrong, entirely wrong. Almost everything about COVID
Yep.
was wrong.
And
I,
interesting, I'm sorry to cut you off. I meant to say this. So the Mennonite families, the parents, I was asking them, were you vaccinated? Because none of these kids pretty much are. Although I've seen vaccinated with measles, but mostly it's no, my kids aren't vaccinated, but I was. And I said, well, why were you? And they aren't. Well, because there's 14 vaccine injured kids in the Mennonite community just in Gaines County. And that's what caused us to hesitate and to research and to read the package insert and to make some informed decisions. And then when the CDC asked me to ask the Mennonites, what can the CDC do to help them? The answer was, we'd like to meet face to face in a private meeting, private room, and bring our 14 vaccine injured kids to have a conversation about this. And to me, that's the story. The vaccine hesitancy that we're seeing, there's a reason for it. And if we can't truth tell on that and confess about that and get just open that whole thing up, because there is ways to risk mitigate. The evidence is clear on that. The studies have been done and more need to be done, but there's plenty that have been done to show don't do it so early. Don't do it when you have a fever. Don't do so many at one time. Don't do it in preemies. Don't do it in an African American male on schedule. I mean, there's plenty that we could do to customize and risk mitigate, not a one size fits all. And then we just go blind to any injury. I mean, this truth of what's really driving the vaccine hesitancy, it's not going anywhere. So we can either face the facts and have an honest, truth-telling discussion about it and then come to a solution, or we can just keep our head in the sand and keep denying any injury at all. They're so rare, they're not worth talking about. Okay, we've been doing that for 20 years, and look where it's got us. So,
Well, if it happens to you or your family, your kids, then you'll think about it. Again,
yes,
it's not every one. It's rare, but it happens. I've seen it, especially with the COVID vaccine. I treat COVID vaccine injuries every day in my practice.
Yep,
Every day. I
yep,
preach out against it. And like you, when I first started treating COVID patients, because I wanted to do something, and I read about the frontline doctors and followed their protocols, did my own research, used my common sense, started using hydroxychloroquine early, and then, of course, ivermectin. I was threatened by our medical board, sent a letter, why are you using this? What are you doing using hydroxychloroquine? So I sent them some studies back to Nashville to the board, and a month later I get a notice, you're okay. You're going to be fine. So
yep,
fortunately, I do live in a state that's pretty good with that. As a matter of fact, we're the only state in the country where you can get ivermectin over the counter
wow,
in Tennessee, the only
that's
state.
awesome. Yeah.
But so there is a thing called cognitive dissonance. I mean, you've described this thing perfectly. Let me ask you something else, Ben. Should people be scared of the measles? If you watch the news, I think they're kind of really putting a little fear in people about the measles. So should America be scared about this?
Absolutely not. But I'm going to tell you, I'm biased. I'm way biased because I preach it and preach it to all my patients. Don't be scared of anything. And that, I mean, that's not but it's true. If we're really scared of something, we got to go deeper into that. What are we scared of? I mean, why are we even here? I mean, that's a whole spiritual journey. But I know what you're getting at. And in general, what I'm going to tell you is no way. I wouldn't be seriously scared of any germ. I mean, it is clear in the literature. It's clear looking back to the 1900s when infant mortality rate was 50%, and there was a 99% drop in infant mortality rate pre-vaccines rolling on the scene. How did we see a 99% drop in all these infectious diseases in babies and death? Cleaned up the terrain. It is clear. Harvard, Mayo, Hopkins, CDC, everybody's published on this. It is so clear. So that's the focus right there. Oh, wow. So these germs aren't to be feared if we just bolster our terrain, get our nutrition. So it's not the gene, it's not the germ. That's what I always preach. We have control and power over that. We can strengthen our immune system, keep the bad genes turned off, keep the bad germs at bay, and when they get in, no worries. You got snipers, you got flamethrowers, grenade launchers. You've got an amazing frontline system in your airway and your GI tract. Now steward it. So no way, don't ever fear. Now we do have a standard Americans that are not metabolically fit. I think 93% are not metabolically fit. That means you're kind of a sitting duck. Your troops, your snipers got one hand behind their back. Your immune system's not as strong as it can be. So it's an opportunity, just like in COVID, to do something about that. Steward that immune system so it'll be stronger. So don't be fearful at all, but get informed, be knowledgeable. My people are destroyed from lack of knowledge. So let's get better and get healthier and stronger. And then for sure, you don't have to fear. Now, I will say the measles that I always read about, heard about, what my parents tell me about, what I saw in Gaines County, in a certain subset, the respiratory part was more than I was expecting. So I don't want to make light of that or say it's not significant. Now, I, of course, haven't had time to do any kind of study. Now, were these kids eating standard American food? Was their vitamin A level? Because vitamin A is so essential for the airway, not only the mucosa, the cilia, the mucus producing cells, but then the macrophages, all the troops that line our airway, they're all vitamin A dependent. So were they low on vitamin A? I don't know. But there's a subset where this respiratory component was pretty significant, but there's for sure treatment, no doubt about it. So if measles is in the community, I'd be loading up on food-based vitamin A. I take cod liver oil every day, no matter what, because our fat-soluble vitamin intake
Me
just
too.
isn't great.
We
But
have it in our office. We have it in every office, and we've done podcasts on cod liver
Yep.
oil. It's an amazing product.
It's awesome. And the import of that in the 1920s we imported that and measles started suddenly dropping. Now that's correlation, but there's a great article on Weston A. Price all about that, the measles and cod liver oil. But that's a great preventative. I mean, just to bolster your immune system, get you stronger, but then actually increasing it if measles is in your home or in you. Vitamin C is awesome. Get to an integrative doctor like yourself. There's so many treatments you can do. Now, this secondary bacterial infection that can come after any virus, after RSV, after influenza, after anything. So that's something to be mindful of. It's something to watch for. And unfortunately, the little girl, now that we have the medical records, we see clearly in the records, unfortunately, the resident on call gave her vancomycin and rocephin, which covers hospital-acquired pneumonias. It doesn't cover community-acquired pneumonia, which every doctor knows this. Unfortunately, it was just a big mistake. She didn't get her macrolide antibiotic, azithromycin or clarithromycin, that would have taken care of that mycoplasma. And she just deteriorated over that hospital course
Do you
until
think
it
it
was
was
too late.
pneumonia? Do you think it was pneumonia that killed her?
Absolutely, I
Not
do. Yeah.
measles. It was a secondary pneumonia.
Correct. The measles she was on the downhill side of that. And what I've seen in this measles outbreak, you get fever the first day, second day, the fever kind of goes away. Third, fourth day, the fever's back pretty high, 104, 105, and the rash comes about day 4, 5, 6, rash, coughing through there. Day 7, 8, the rash is going away and the cough's going away. Roughly, that's kind of what I'm seeing. So day 7, 8, 9, that cough's worsening, the fever's worsening. So in her story was that that initial trajectory I showed you, the rash was clearing, everything was getting better. She was getting way better. And then suddenly, boom, day 9 or 10, fever spikes back up, shortness of breath and cough reemerge, real aggressive, an obvious secondary bacteria. And that's when she went to the hospital. At the end of the measles, secondary bacterials coming. They diagnosed it. Chest x-ray showed left lower lobe infiltrate. They cultured and they did some PCR that showed mycoplasm. Didn't start the right antibiotic. So it looks from the record, absolutely her respirations got worse, her oxygenation got worse on the wrong antibiotic all through the weekend, Friday, Saturday, Sunday, Monday. And she just continued to deteriorate, eventually put on the ventilator and just was not on the antibiotic that would have covered. So I do believe that is what happened.
You know, I put every one of my COVID patients on macrolide
Yep.
to cover because we knew the secondary was coming. But
Yeah.
that's a sad story. Are you still treating quite a bit of it? Do you think it's progressing? Is it going to be something that's
It's
most doctors need to know how to treat?
Yes, it's still going. It's kind of into some other surrounding communities and even states I'm reading. But yeah, it's still going. I'm not actually treating as much, and it seems to me, talking with the folks in the Gaines County, the Mennonites really took a hold of the cod liver oil, understanding vitamin E or A, how important that is, and they're just really doing some aggressive preventative and treatment at home. So I think it's just they're kind of handling it better, I would say. But it's definitely still here, no doubt about it. And so it's something to be mindful of, and especially little ones. Be if
And
you're
treat early.
treat early, use that budesonide. It really helps knock down that inflammation. We've seen miracle turnarounds with that.
You know, I'm a big believer in giving my patients prescriptions for their home medical kit. And it's
Yeah.
always going to have Zithromax. It's always going to have a nebulizer with budesonide
Yep.
and maybe Provenal in it. It's going to have, What else is going to have? Of course, it's going to have Zofran. I give my medical kit. I trust my patients to call
Yeah.
me. They
Yep.
have it there if they're
Yep.
traveling. But
Absolutely.
vitamin D, too, we always have to remember vitamin D. As a matter of fact, when COVID first started hitting, I put a big magic marker on a piece of cardboard box, and this is crazy, but I put on there, take vitamin D, and I stood on the side of the interstate beside my office with the sign, take your vitamin D. It was hilarious. It kind of went viral, but that was early on, and we gave big doses of vitamin D, and we did a lot of IV vitamin C with
Yep.
it, and oxygen, home therapy, but it worked. And
Yeah.
to me, the worst thing you could do was go to the hospital. If you had COVID,
Yep.
you went to the hospital, there's a good chance you're gonna die.
Yeah,
And
absolutely. We did the same thing that you're talking about and getting those oxygen concentrators to people. And I think it wouldn't be a bad idea if churches maybe just stock up on 10 or 20 oxygen concentrators, rent them out or give them out and
yep,
check
we
them
did
out
that. We
when
took
people need that.
tanks, and with the plug-ins are great. You can get up to 10 liters, and
Yeah.
it's just a great treatment. We have a few at the office that we loaned out, but
Mm.
it was a tragedy of untold proportions.
Yeah.
COVID was, and
Yeah.
um,
If we want to
this
regain the confidence of the public, we need to do the confession on that, and we need to just come clean on it. I'm hoping that's what I've told Bobby and the CDC. I've advised that they go on and do a CDC webinar on treatment. I mean, you can talk, y'all been talking all day long about preventative, and that's one, but we're talking treating sick people. So let's do a webinar. Let's get some experts on there. So then doctors can log in and, oh, okay, here's my treatment protocol. And then we can just treat these people, bring the fear down, and that'll go a long way to making up for some of this mistakes that we made. Not only confession, but then being proactive on, all right, guys, we're going to talk treatment because we didn't do it during COVID.
agree 100%, but you're not going to get pharmaceutical companies to put on television, buy your cod liver oil from us, because it's over the counter, it's off label, it's cheap, there's no money in it.
Yeah.
So, but we got to get the word out, and certainly your work with this has just gone viral. It must have been cool to talk to RFK Jr. I really hope he can turn a lot of this around. But we have to head in a different direction with our medical system. It's just
Yeah.
horrendous. We're able to operate in utero on a fetus, on a heart, yet we can't prevent people from getting obese
Yeah.
and prevent these illnesses and treat them in the right manner. So,
Yeah.
but what you brought up about Jamie Winship, and you can go to, my viewers know that we've done several podcasts with Jamie, and they're just great every time. And a lot of healing occurs by that method too,
Yeah.
as much as us physicians do. So we have to be humble. We don't know everything,
Yeah.
but if we have empathy and we pray and we ask God to help us, guide us in our treatment, because it's really coming from Him, not us.
Yeah.
I tell my patients that all the time.
Yeah.
But you certainly, it's been so great to have you on this podcast. This has been one of the best podcasts I've ever had. I appreciate this very much, and thank you for going in and doing the extra mile with those kids. It's just amazing what you have done and the way you've changed your way of practicing. It's just the right thing to do, and I thank you for that. And just
thank you, Tom.
incredible. Dr. Ben Edwards, any other last words of wisdom for us?
Well, all glory to God, as He's taken me on my personal journey, and I've tried, and I don't do it perfect, but trying to submit to Him and not my own thinking, my own ways, or submit to spirit of fear, or spirit of man pleasing, or spirit of performance, or all these things. I just encourage the audience to keep pursuing the kingdom first. Trust God. Talk to Him about when you don't trust and what you fear. He can handle it. Just that honest confession I was talking about that we need in the healthcare, we need it in our own personal life, so that we can wake up every day and just be who God made us to be. And I mean, I definitely don't have it down perfect, but that's what helps keep me going, is trusting Him and trusting who He says I am. And I just got to wake up and be that. So that's what I'm trying to do every day. And I know you are too, Tom, and just encourage the listeners to do the same.
Amen. Well, Dr. Ben Edwards, thank you so much. It's been an amazing talk. I really want to invite you to come up to Tennessee. I'd love to see you.
I'd love to come see you.
Thank you
I gotta
so
play
much.
one of those guitars back behind you there.
Do you play?
No, but you could teach me maybe.
I'd love to teach you. I'd love to teach you how to play guitar. Ben, thank you so much. It's been
You're welcome.
wonderful. I hope this goes viral because you have spoken words of wisdom today, not only about you're treating measles, but the way medicine should be and the way we should be as people. So thank you so much. And guys that are listening, thank you for listening. We'll see you next week.